Hi, I'm Dr. Rena Azar, and
I'm Katie Henson.
I am a pelvic floor reconstructive specialist that you have probably already talked to, which is why you're getting this video. This video is going to talk a little bit about the integration of three systems that I think are very important in the rejuvenation and the return of normal function to the female pelvic cavity, which includes the vagina, the bowel, and the bladder. Those are the three components that are all together in one system. So we're going to talk a little bit about what three things can help to make these organs that are so important to us every single day function optimally. The most common cause of damage to these organs is childbirth, but repetitive heavy lifting, sometimes having an inherent poor quality tissue in your body will make that part of the body that's constantly subjected to pressure as we are vertical have functional problems because of damage. The damage is, in my mind, basically either anatomic or neurologic or an interplay between the two. In other words, when we have damage, I'm just going to talk about childbirth because it's a very common event. I think people can visualize this and embrace this concept a little bit more easily than maybe some of the other ones that relate to pelvic floor damage. Babies' heads coming down through the pelvis, they're going to do damage that we can see. And most of my women have indeed seen their pelvis. I kind of get the mirror out, we get the speculum out and take a look and see what the front wall, back wall, and the apex or the top of it looks like if we can see that far. And I can show people pretty clearly, we can see the anatomic damage. That's where the tendons, ligaments that attach muscles to their sites of origin, that attach those organs and suspend them where they're supposed to be, when they get torn and shorn and pulled away and stretched, they're going to compromise the anatomy. And anatomy falling out of position will affect the function of the organs that it suspends or holds into position. There's also neurologic damage. Neurologic damage we cannot see with the naked eye. But anytime you damage a muscle, tendon, ligaments, etc., you're stretching and pulling on the little nerve fibers that run through our pelvic organ cavity. And they coalesce or come together and go up the spinal cord and communicate with the brain. So that communication is drastically affected when you have damage to the nerves. Anatomic damage is something you can visualize, and you can actually imagine that over time, with more stress, trampolines, vigorous activities, intercourse, things that are stressful for the pelvic floor are things that are going to promote that or actually make that the progression of damage worse. It's going to become worse over time. Well, same thing for neurologic damage, and that's one, once again, you can't see. Sometimes people will come to me with anatomic damage first, and they'll come back years later when the neurologic damage is showing. So let's talk about neurologic damage because it's going to be an important part of you understanding why physical therapy is important both for anatomic damage correction and neurologic damage correction. So in brief points, I'm going to say that neurologic damage affects urinary frequency and urgency. Why? Because a normal bladder will tell the brain, I am full when it is appropriately full, but a neurologically damaged bladder doesn't always know when it's full. It can either be overly full and not signal the brain, or it can be not very full and tell the brain it's very full when it's not. So that is one way that we will see people show that they have neurologic damage. Another really common principle is that the brain can control the bladder. The bladder feels full, it wants to go, it's on its way to the toilet, and the brain is like, nope, not yet. You're going to wait till she goes all the way across that room, goes through that door, opens the door, goes in there, turns around, shuts the door, pulls her pants down, sits down. Now you're going to go. And a lot of people know what it means when you have neurologic damage and that control of the brain over the bladder is not working well. It's a very frustrating thing on a daily basis for many, many people. Another point, when you are neurologically compromised, the bladder muscle is like a balloon. You have a balloon-shaped muscle with all these overlapping fibers and they contract together. That is not a coincidence. The brain says, okay, all your fibers contract at once and you get a nice emptying effort. If it doesn't go in a synchronized way, you're going to get like a bag of worms effect, and that does not empty well. So poor emptying is related to neurologic damage. Also, poor emptying is related to a dyssynergia or a lack of coordination of two muscles. Most people know that the bladder has a round balloon-shaped muscle. Not a lot of people know that there's a little tube that empties the bladder and there's a muscle around that point where that tube inserts into the bladder called the sphincter muscle, an intrinsic sphincter muscle to the bladder. So guess what? When we store urine in the bladder is relaxed, the detrusor or balloon-shaped muscle, and the sphincter muscle is tight. And when we empty, we have to contract this and open this. Opposite actions. Guess what? Not a coincidence. Coordinated by, you guessed it, the brain. So neurologic damage will translate into hesitation, or intermittent stream, or slow stream, because perhaps this muscle is not opening up and relaxing enough to let the urine flow out. So why does physical therapy help both? I don't think it takes a lot of understanding to know that when muscles have been torn and shorn and compromised, and we're trying to strengthen them so that they can help hold the structures. If you have an anatomic problem that's really big, you may not have much muscular attachment, but any muscular attachment in there is part of helping that pelvic floor to suspend itself and hold things in proper position.
Mm-hmm. Yeah, so so the pelvic floor's role in the urgency and frequency and bladder control is pretty simple, yet it's just extremely important to understand. So the pelvic floor muscles, when you contract them, they're sending a message to the bladder that it's not time to go yet. And so when the urge hits you, those muscles, they're supposed to activate and give that message to the bladder not to contract. And so sometimes people don't even know where those muscles are. They have no idea where they are, what they feel like, what to do with them. And so physical therapy will help to actually teach you about where your muscles are and what they do. It will tell you how to use them to suppress the urge to urinate and to actually increase that pressure and around the neck of the bladder and the urethra to